I'm Josie. I'm going to be your nurse today. Could you
Hi.
tell me your name and date of birth?
It's Matt Miller, June 8th, 1968.
Okay, good job. What brings you here today, Matt?
Well, I was cleaning my gutters and then I must have fell because when I woke up I was laying on the ground.
Okay, and how have you been feeling? Do you have a headache? Are you a little bit confused, feeling dizzy?
Yeah, I got a headache. Yeah, dizzy, kind of nauseous.
Okay. Is your vision a little bit blurry? You've been feeling a little bit tired?
Yeah.
Okay.
Hard to stay awake.
All right. How long ago did this happen?
Probably 5 or 6 hours ago.
Okay, and then can you tell me where you hit your head?
It was over here, my left side.
Okay. Is the headache that you have constant?
Yeah.
Do you remember who brought you here?
I think it was my wife.
Okay. If you had to rate your pain on a scale of 1 to 10, with 10 being the worst pain you've ever felt, what would you rate it?
Maybe like a 7.
Okay. Has it gotten worse, your pain, or has it stayed the same?
I guess it's pretty much the same.
Okay. Does anything make it hurt worse?
Like bright lights.
Mm-hmm. And then what makes it feel better?
Nothing so far.
Nothing? Okay. Do you have a history of headaches, or have you had any head injuries besides this one?
Probably when I was a kid, but nothing in a long time. It's been a long time.
Okay. Have you ever had any seizures, tremors, numbness?
No.
Any tingling, dizziness, or vertigo?
I mean, I'm dizzy now, but
Okay.
yeah.
Have you had any loss of consciousness?
Well, I think when I fell, I must have, because I don't remember anything except laying on the ground.
Okay. Any difficulty swallowing or speaking?
No, not yet.
Okay. Are you taking any medications right now?
No.
All right. I'm going to check your alertness. So could you tell me your name again?
Matt Miller.
Do you remember what day it is?
Sunday.
Close. It's Monday.
Oh.
Almost had it. Do you remember where you are right now?
At the hospital.
Mm-hmm. And do you know why you're here?
Because I hit my head.
Right. So the patient is alert and oriented ×3. He's speaking a little bit slowly and quietly, appears to be in a lot of pain, and is very somnolent. He closes his eyes often and shows signs of confusion. Okay, I know you probably just want to rest, but I'm going to take your vital signs now. So the patient's temperature is 96.5. I took that orally. The pulse is 62 beats per minute. It's regular with a grade of +2. The respirations, he has 12 respirations per minute. The breaths are deep, slow, and unlabored. His blood pressure is 120/80. I took his blood pressure when he was sitting up. That's a normal blood pressure. And then his pulse oximetry was 99%. I'm going to check your eyes now. Could you take off your glasses? All right, now can you just focus on this for me? Okay. The left pupil is slightly bigger than the right. The pupils are dilated. They do not constrict, and the patient is able to follow the pen light. All right, could you raise your eyebrows for me? And close your eyes as tight as possible. Okay, the face is symmetrical. You open your mouth. Okay. The oral mucous membranes are pink, moist, and intact. There are no abrasions or redness present. Okay. I'm gonna check your skin color and moisture and stuff in your arms. Okay. I'm gonna check your legs. The skin is a pale color, feels a bit moist to the touch. It's a warm temperature. There is no edema noted for the upper or lower extremities. I'm going to check your capillary refill on your fingers. And your toes. Okay, so the capillary refill occurs within less than 1 second, which is good. All the nail beds are pale pink color, so everything's normal there. Okay, I'm going to listen to your carotid arteries. All right, no bruits are noted upon auscultation with that. Okay, so now I would listen to the heart sounds. For the aortic, I would listen on the upper right portion of the heart. S1 would be louder. For pulmonic, I would listen between the right ventricle and pulmonary artery. S1 would be louder again. Herb's point, I would listen at the third intercostal space in the left lower sternal border. S1 and S2 would be equal. And then for tricuspid sounds, I would listen between the two chambers on the right side of the heart. S2 would be louder. And lastly, mitral sounds. I would listen between the left atrium and the left ventricle, and S2 would be louder again. So the patient had clear and audible S1 and S2 sounds, and there were no murmurs. So now I'm going to listen to the apical pulse. The pulse was 63 beats per minute, and it was normal. Okay, I'm gonna listen to the lung sounds. If I could have you just turn to your side, this, so I can listen posteriorly first. And each time you feel this touch you, just take a deep breath in and out. Have you hold your arm like this, and then same thing, deep breath in and out. Same thing, other side. Okay, and then I'm going to do it in the front now. Alright, everything sounds good and normal there. Alright, now I'm going to just inspect, palpate, and auscultate your abdomen. So start with the auscultating. everything sounds good there. They have a normal rhythm and regular effort. Now I will palpate. Okay, there are no abnormalities or masses found there. Overall, nothing abnormal with the abdomen. I'm gonna check your range of motion now. Could you turn your head side to side? And then could you turn it up and down? Alright, you'll have to stand up for this one. Could you bend over and just touch your toes, or try to touch your toes? You don't have to get all the way down there. That's okay. And then can you bend backwards? Like that. And then can you put your arms up like this, both arms, wiggle your fingers? Can you flip your hands like this? Can you put your arms out to the side and then reach up for the ceiling? Okay, now I'm gonna have you lay down on your stomach. All right. Can you bend your legs up like that? Okay. Can you lift your legs? Back there? Yep. Okay. All right. Can you bend your feet like this? All right. Good. You can sit up now. All right. I'm gonna test your strength. So can you put your hands on mine and then try to push my hands away? Good. Can you try to pull, nope, like this? Can you try to pull your hands forwards? Good. Can you try to stop me from pushing your hands down? Good. And then try to stop me from pushing them up. All right. Can you pull my hands towards you? Hold my fingers. Good. And then can you push your foot down? Can you push it up? Good. And then can you try to lift your leg? Good. Very good. All right, last thing we have to check is your gait, which is your walking. So I'm gonna have you stand up and just walk back and forth like you normally would. Okay, that's good. So while walking, the body appears symmetric. The left arm swings forward when the right foot steps, and vice versa. Patient does not have any problems with his balance. You can sit back down. So I think we're done today. I'll be back to check in on you soon. Hopefully you're feeling better.
Thank you.